midline gap.
So what I mean by that is a gap between the front two teeth. Considered desirable to some people, considered lucky in some cultures, and some people want to close it up. This patient is one of those patients who wants to close it up. Let's have a look at the photographs. This is how she presented to me. She had a gap between the front two teeth, and what I noticed was that she has uneven edges on her teeth, and so I think she's also been wearing them down. So my mind is now going towards tooth wear and how we can improve her function and bite so she doesn't wear her teeth down further. The midline gap does pose some challenges, and the challenge is that when we add here to close the gap up, we're going to find that those teeth become a lot wider. What we could do is we could close the gap up by moving the teeth, but what that will also do for this patient is it will bring things closer in, and she actually does have wear on her lower teeth. So we went for a different approach. I didn't want to introduce a proportion issue where the front teeth look a lot wider and bigger than the others, even though we can use masking techniques and illusions that we do all the time to try and improve that. I still thought it wouldn't look right for her. The lower arch was actually hitting against her upper arch, so we used a clear aligner treatment, kind of like a removable brace that is well known in Invisalign. We used something called ultra clear align for a very short period of time, just a few weeks. What that did was move the lower teeth so we have more protection against the uppers, and so we don't see this sort of flattening and uneven chipping of her upper teeth. Once that's resolved, we whitened the teeth, and I produced a handmade trial smile because for this patient we chose 8 porcelain veneers. Now the photograph here shows the preparation required for the ultra thin porcelain veneers on the upper teeth. The gap is still there. We have a little bit of roughening up on the surface, but on some teeth nothing has been done whatsoever. These teeth have been slightly smoothed, and here we've got a little margin, and these green areas on the gum are a specific paste that we use to ensure the gum is healthy before we take the mold. And that's the extent of it. There's an incredible amount of tooth here. There's no stumps in sight. It's a very, very safe way to approach veneers. These are ultra thin or super thin veneers. You can see on the lower, we still have the aligner that we're keeping in place so that her teeth stay in the same position until we've finished our treatment. The handmade trial smile for this patient looked like this, where the gap was closed, and we allowed the patient to test drive this so she likes the angles, the reflection, the lengths, and we moved on to the final teeth, which you can see here. The gap is closed, and the illusion avoiding the teeth looking wide has been created by effective shape, texture, angles, and light reflection. We worked from here to here for this patient, so we actually finished with 2 more ultra thin veneers than we were initially planning, because we both felt that a little bit more width on these teeth would just make the smile pop and wider, and it would just make it look absolutely as perfect and naturally perfect and bespoke as she wanted it. These 4 teeth required absolutely no touching whatsoever. The porcelain veneer has been made and is stuck to the tooth itself. This is a case that also has a lot of natural effect in the porcelain and just mimics nature. With the lower teeth, her own teeth, and the upper teeth treated, you can't even notice a difference in the appearance between a natural tooth and the porcelain veneer. And that for me is something that I really love to see.